So hello and welcome everyone to Congressman Bobby Scott's webinar on the American Rescue Plan. My name is Austin, like he said, and I'm going to be the moderator for the evening. This event is going to be a chance to learn and ask questions about how the American Rescue Plan will help end the COVID-19 pandemic and how the plan offers important relief to seniors. If you would like to ask a question, please use the Q&A function at the bottom of the Zoom window, or you can also hit the raise hand button. If you raise your hand, though, be prepared for me to call on you and I will give you the option to unmute yourselves to ask your question. However, before we begin the question and answer portion of the webinar, I'm going to hand it over to Congressman Scott for some opening remarks and introduction of the panelists.
Thank you, Austin, and good evening. I want to thank everyone for participating in this webinar on the American Rescue Plan and how it will help seniors. Joining me this evening will be Max Richtman, President and CEO of the National Committee to Preserve Social Security and Medicare, and Dr. Vladimir Markovic, the Chief Medical Officer of the Hampton Roads Community Health Center. Before I turn it over to our experts, I'd like to make a few opening comments, and first to discuss the American Rescue Plan as passed by Congress and signed into law by President Biden. The plan will help bring the COVID-19 pandemic to an end and help rebuild the economy by safely reopening schools, ramping up vaccinations, putting money into people's pockets, and putting people back to work. In Congress, I serve as the chair of the Committee on Education and Labor, and in that role, I've been focused on how we can get students back in the classroom as quickly as possible, but safely. We know that we're not going to open the economy until we reopen the schools, and we've got to open the schools, so we've got to open the schools, but we've got to do it safely. The rescue plan makes sure that the schools have the resources to open safely and so that they can comply with the Cdc guidelines. Cdc guidelines have been very specific. They said you need to have proper ventilation. A lot of schools around the country do not have proper ventilation. You have to have PPE for the employees, masks and disinfectant. And you have to have staff to disinfect. The schools aren't going to disinfect themselves. Transportation expenses will go up because you're going to have fewer students on the bus. That would mean more trips. You've got to have nurses, counselors, and a lot of other things involved in opening the schools safely. The rescue plan has those resources. It also has resources to make sure that we can make up for lost learning opportunities. Over the last year, a lot of students have done okay on the distance learning, but frankly, a lot just haven't done as well. And we need to make sure that they catch up. We have a lot of resources in the rescue plan to help schools reopen safely and to catch up for lost learning. As chairman of the rescue plan of the Committee on Education and Labor, in writing the plan, we can just see what Virginia got. Virginia will receive about $2.2 billion for K through 12 schools, about $850 million for institutions of higher learning, almost $800 million for childcare so people can go back to work, and $16 million for Head Start. This will go a long way in making sure our students can get back to school and that our adults can go back to work. The rescue plan will also help ramp up vaccinations and get more shots in more arms. President Biden made a promise to administer 100 million doses in the first 100 days. Well, he's already done that in the first 52 days, and he set a new goal for a total of 200 million vaccines in the first 100 days, and it looks like we're going to be able to do that. President Biden also announced that every adult should be eligible to get a vaccine by April 19th. That doesn't mean you'll be able to get a vaccine, but you'll be eligible to sign up. In Virginia, if you haven't already done so, you can pre-register for a vaccine appointment at vaccinate.virginia.gov or by calling 877-VAX-IN-VA. That's 877-829-4682. In addition, vaccine appointments may also be available through your local pharmacy, which you can find by visiting vaccinefinder.org. Vaccine Finder, all one word, The American Rescue Plan's significant investments in strengthening Medicaid and Affordable Care Act were also part of the plan. It'll make healthcare more affordable for millions of Americans as we continue to confront the public health emergency. For older individuals who are not yet qualified for Medicare, the plan increases the availability of premium tax credits, which will significantly lower the cost of health plans available through the Affordable Care Act, better known as Obamacare. On a quick note, the Biden administration also created an open enrollment period on healthcare.gov through August 15th. So if you missed the sign up period last December, you can sign up now. So if you or anybody you know needs health insurance, now is the time to get covered. No one should be uninsured, especially during this pandemic. And we made a lot of people eligible for much lower premiums. So you want to check to find out if you can find affordable coverage. And a lot of people will be surprised that it is a lot more affordable than they thought, and a lot more affordable than it was back in December. The American Rescue Plan is also a historic victory for about a million retirees who are at risk for losing their pensions that they'd worked so hard to save up for. Because of the relief package, construction workers, truck drivers, industrial bakers, grocery store workers, and many other hardworking Americans will have their retirement security they deserve. We solved the problem that is called the multi-employer pension crisis that will not only protect the workers, retirees, and their families from financial ruin, but it will also shield many businesses and businesses from bankruptcy and taxpayers from steep costs that would result if the private pension system collapsed. The looming crisis, if we'd let the thing fall off the cliff and go bankrupt, would cost the taxpayers at least $170 billion over 10 years. And we're able to solve the problem for a lot less than that in the rescue plan, and the retirement will be secure. We've been working on that plan for about the last almost decade, and we're finally able to solve it. Additionally, the $1,400 stimulus checks have either arrived or are on the way. The Social Security recipients that do not need to file taxes were unfortunately delayed in getting their economic impact statements. The IRS has estimated that the majority of payments for those who fall into that category should have received their payment at least already, but today they should have received it by today. Some federal benefit recipients may need to file their 2020 tax return, even if they don't usually file and even if they don't owe taxes, to provide the information to the IRS to send payments for any qualified dependent if you do not receive the full amount of your stimulus payment. You can also visit irs.gov/coronavirus/get-my-payment if you have further questions. That's IRS, Internal Revenue Service, irs.gov/coronavirus/get-my-payment if you have further questions. We also expanded the child tax credit in the plan, and that is expected to result in cutting the child poverty rate in half. We also extended increases in SNAP benefits through September. The plan also extends critical unemployment benefits and much needed relief to small businesses to keep people in jobs. And as the chair of the Education and Labor Committee, I also worked hard to make sure that the relief plan included $1.4 billion for programs in the Older Americans Act, which is critical given what we know about COVID-19 disproportionately affecting seniors. This funding will strengthen supportive services like transportation, home care, and preventive services, and includes more than $31 million to support older individuals across Virginia. These are just some of the things in the plan. It also provides $20 billion in emergency rental assistance to help Americans in need, and 10 billion in homeowners assistance to help with their mortgage payments and utility bills. Those programs are administered through the state and can be accessed through the housing and community development at the state level. Earlier this year, the Biden administration announced that the federal eviction moratorium will be extended to June 30th, and this will protect millions of tenants. But at the end, they're going to need those funds to make sure they can pay up their rent so they don't get evicted after June 30th. So contact the Department of Housing and Community Development. The website is DHCD, Department of Housing and Community Development, DHDC.Virginia, written out, .gov, DHCD.Virginia.gov. And I'm sure that we'll get into many other provisions on this call. I'd like to be remiss if I also didn't mention that this week, the president unveiled his American Jobs Plan, a bold vision for creating millions of good paying jobs and protecting the health and well-being of our children, workers, and communities. This plan will build off the momentum of the American Rescue Plan and get struggling Americans back to work. The Infrastructure and Jobs Plan also keeps President Biden's promise to build back a better economy where workers can earn a decent wages and a voice in the workplace. The investments include not only the normal roads and bridges, but also schools, childcare facilities, replacing toxic lead pipes that endanger countless communities, and other things that, like job training, that are not usually part of infrastructure packages. So I applaud the president for his leadership in proposing a plan that ensures that all Americans can share in this recovery. And I look forward to working with my colleagues to translate this vision into legislation that we can put in his desk. Now, I'm going to turn over for comments to Max Richtman, the CEO of the National Committee to Preserve Social Security and Medicare, for whatever comments he'd like to make. Max?
Thank you very much. Can you hear me,
I
Congressman?
can hear you now, yeah.
So I'm sorry, I got stuck in traffic. I just walked into the House. I was hoping to look a little better, not as good as you, but a little better for your town hall meeting. But thank you for inviting me. It's always an honor to be at an event with you. And I'm glad to have a chance to talk about a little bit about the American Rescue Plan, especially how it affects older folks. And that's really important. And we owe you a debt of gratitude for your input in that regard. We know that seniors have been the hardest hit by this pandemic. 8 out of 10 deaths of the COVID virus have been in adults over 65. So again, thank you for ensuring that some of these challenges that seniors are facing, have faced over the past year, are addressed by the American Rescue Plan. And as you pointed out in your comments, you were instrumental as chair of the House Committee on Education and Labor to include funding to the tune of $86 billion for multi-employer pension plans that were, as we all know, close to collapse, and you prevented that from happening. And because of that, millions of people around the country, they may not know how indebted they are to you, Congressman, but retired truck drivers, retail clerks, builders, others will continue to benefit from your input in that legislation. And of course, the $1,400 payments are vital to Social Security beneficiaries, veterans, and they are automatically eligible for those benefits. A couple of things you already pointed out, but I wanted to highlight the legislation includes vaccinations, testing, safer nursing home care, more funding for strike teams, they're called, in nursing homes to contain and mitigate the virus. Over $12.5 billion for home and community-based care. That's really important, and of course will help add tax revenue to state governments that will also help those receiving Medicaid. assistance in home and community-based care. This is really the foot in the door, I think, in improving Medicaid assistance to home and community-based care. And I hope it's just the beginning, and we're on that path. And I know that President Biden has included, I think it's $400 billion in his infrastructure plan for home and community-based care. Finally, you mentioned this. I got this just as I got on, so I'm glad you pointed it out. But I want to emphasize how important the additional funding is to the Older Americans Act. The Older Americans Act came out of your committee, was reauthorized. We very much appreciate what you did in reauthorizing that and in adding almost $1.5 billion to the Older Americans Act. Why is that important? Home delivered meals, Meals on Wheels, so important to seniors that are homebound. And sometimes that's the only contact they have with a live human being besides getting a warm, nutritious meal. And thank you for putting that additional funding in for those meals and for the additional funding for the low income home energy assistance program, LIHEAP as it's called, keeps people warm in the winter, keeps them from suffering from heat in the summer. We thank you very much. And I personally want to thank you so much for everything you've been doing all these years. I've known you a long time, and you've been a champion for seniors since you first got there. So thank you, Congressman.
Well, thank you. Thank you very much. Thank you for your comments, and thank you for all you do for seniors. And now we'll hear from the Chief Medical Officer of the Hampton Roads Community Health Center, Dr. Markovic.
Thank you, Congressman Scott. I appreciate that, and I appreciate the invite to have me here. I'm very thankful to be here. And I can only definitely echo what the gentleman was saying before me. We thank you very much for all of your efforts that you've been doing. I can tell you personally from a lot of my own patients that I see on a regular basis, they have benefited immensely from Medicaid expansion, a lot of the other services that have gone through that they wouldn't have gotten any of the care that we currently give them without these efforts. And a lot of these patients realistically are alive today because they have these efforts. Patients that had diabetes and couldn't get their insulin, blood pressure problems, couldn't get their medications. And now we can see even more appropriately with coronavirus, the opportunity for them to be actually eligible to get care and vaccinations and things of that nature without having to have the number one concern, which is always going to be cost for a lot of those populations. And that's a huge determinant and social determinant of health for a lot of these populations, so they don't get the care that they need. So definitely thank you very much for all of your effort and your continued efforts there. One of the big things I wanted to definitely touch on here today would be the coronavirus vaccine in and of itself in regards to the current protocols and some of the things that are coming down the pipeline here. So our current protocols that we have now, as most everyone knows, trying to get most of the senior population vaccinated. And thankfully, we've been able to do quite a good job of that thus far with the current administration and with your efforts as well. So again, thank you for that. We've definitely now been able to open up to more cohorts of people. A lot of our teachers are now getting completely vaccinated. The latest numbers are there, getting closer up to the 80–90%. So that's looking very, very good. And one of the big keys to be able to open up our schools. So that's going to be very important to do. But most importantly, and to touch on your point, that all Americans 16 and up are going to be eligible for the vaccine, and not the too distant future. April 19th is not too far away, to say the least. So that's going to be wonderful that we can offer these types of things to all of these people so they can get properly vaccinated. And on those efforts from FEMA, from the pharmaceutical companies, from CVS, Rite Aid, a lot of those local entities, ourselves personally, Hampton Roads Community Health Centers, we've distributed over close to 1,000 vaccines at this point to patients in our community here in Portsmouth and in Norfolk, and trying to fully expand that process in and of itself. I know there's been, unfortunately, a lot of information and sometimes misinformation about the vaccine. So it's very important for all of us to make sure that we continue all of our efforts as much as we can through vaccinating as many people that are eligible as we can. But most importantly, with these vaccinations comes also some of the protocols that lie in getting the vaccine in and of itself. So a lot of the precautions that places are going to take would be to allergenic effects from these vaccines. So we take these things very seriously and make sure that we monitor people for a minimum of 15, upwards of 30 minutes after their vaccinations to make sure they have not had any bad side effects. And thankfully, as of our current numbers, we have not seen that has happened as of yet, at least in our local district. So that's definitely very reassuring, because the number 0 is a great number for those types of effects. So we look to definitely continue those efforts, and thank you again for everything you're doing to support us so we can help our community.
Well, thank you, Doctor, and thank you for pointing out as a matter of public policy, that the vaccine is free. That was a policy decision that was made early on, that with all the money we were putting into research and just the public policy nature of it, that we didn't want people to have to decide, well, I can't afford to get vaccinated because I have to pay rent this month, or you get the vaccine or you buy dinner. No, the vaccine is free, and we have enough funding in there to make sure that that happens. And so I appreciate you pointing that out. And so at this point, Austin, we have questions?
Yes, we do. And just a reminder to everyone, if you want to ask a question, you can use the Q&A function at the bottom of the Zoom window, or you can just click the raise hand button and we will go to you live. So the first question we have says, I'm a registered nurse and would like to volunteer to administer the vaccine, but the online form requests copies of my nursing license and driver's license to be submitted online. I don't want to do this. Is there a way to register in person?
Doctor, can you respond to that?
Yes, with a lot of those types of things, it generally depends on which entity that you're trying to go through. There is options to do things in person. You would just want to call ahead of time to your local entity, so that way they can clear you and make sure it's safe enough to do it in person. The only reason that they're pushing more for the online presence is more for just infection control reasons. But to that end, you can still complete those things in person. It's just a matter of calling them directly and just setting up that direct service so you can drop that off directly. It's understandable, and in technology times, it would be a little concerned that who we're sending our information to, so we don't want it to be stolen. So you can still do that in person. Good question.
Okay. Awesome.
Next, it says, are there any plans to try to get affordable long-term care insurance for older Americans that need it but can't afford it?
We tried to do long-term care in Congress a couple of decades ago, but the adverse reaction was so immediate and swift because of the costs that we ended up dropping it. Max, do you want to say anything about that?
Well, I remember that adverse reaction, and I think a lot of that was related to tax issues and the funding of long-term care. But I do think it's overdue. We've talked to a number of members of Congress who would like to begin having some component of long-term care added to the Medicare program. Medicare is a great program, but it doesn't cover long-term care. There is Medicaid. That's the program that does cover that once you use up all your assets. But short of that, there's not much protection in the Medicare program at this point. There are a few bills that were introduced in the last Congress that will open that up a little bit, but nothing really that I know of so far this year.
Okay. Yeah, there's something we need to work on. Austin?
Yeah. Next, will the vaccine be free in perpetuity?
As far as I know, Dr. Markovic, do you want to comment?
Yes, I would certainly hope so. I think it's too early to tell at this point. Really, I think what that's going to be contingent on is also if we end up needing booster vaccines in the future and things of that nature. So once the virus has been effectively quelled, then we can see if boosters are going to need, is it going to be a yearly type of a vaccine? And then that would ultimately answer that question if it turns into more of a flu shot that's yearly as opposed to just something we're doing once only. If it's only once only, well, then it's not going to matter. But I would gather that if it's in terms of public health, it would probably be in our best interest to continue to make it of no cost.
And I think for the same reason, most insurance policies provide the flu shot with no copay. The cost to the insurance company in a case where somebody is infected is so much that if they would encourage people to get vaccinated, and that would it'd be a win-win. It doesn't cost them that much compared to what they would end up paying if someone got infected. Thank you. Austin?
Yeah, looks like we have some questions in the chat. One question says, many seniors are victims of abuse and neglect. Are there any updates on the Elder Justice Act?
Max, you want to
Yeah,
comment on that?
I neglected to mention that in my comments, but the additional funding for the Older Americans Act is really, the official title is the Older Americans Act and Elder Justice Act. And that was the $1.4 billion that you were able to get into the relief legislation. And part of that does fight elder abuse. It provides additional funding, very much needed, for programs like long-term care ombudsmen who protect nursing home residents from abuse. And we have found in listening to some of our members, protection against elder abuse is especially important during the pandemic. So this additional funding will go a long way through the Older Americans Act in making it more possible for the ombudsman to exist and to be able to make sure that there's a watchful eye in those nursing home residents for elder abuse.
Thank you.
Next,
Austin?
yes, it says, there's a question that reads, what can be done about the Postal Service? I know of an individual who was given 7 days to turn in their VEC application. They mailed it within a 2-day turnaround, and through tracking, they have missed the deadline for VEC because their application has been sitting in the Richmond post office for the past 2 days, thus missing the deadline set by VEC. What can be done about the post office delays?
We're in the process now of trying to deal with that. The service of the U.S. Postal Service has deteriorated over the last year or two. The Postal Service is governed by a governing board, so the president can't fire the director directly, but he has made several appointments. And I think they may have a majority now to deal with the director. They got caught up in politics last year with the mail-in ballots, where the president was open about the idea of sabotaging the Postal Service so as to sabotage mail-in ballots. And he wouldn't even coy about it. And the director of the Postal Service was found to be doing things like removing mail sorters and other things. I think we need a new director, and we're in the process now of trying to get the board of directors to find someone who can run the program a lot better. They have some financial problems, but financial problems are not the cause of the problems with the mail. And we're all suffering. Our office gets complaints every day. I sent a letter to paying a bill. It took 2 weeks to get there. It's just unacceptable. And hopefully the we get enough directors confirmed, they can fire the director and put somebody in there that is committed to improving the service.
Congressman, Mr.
Yes.
Chairman, I wanted to comment on that. A couple of things. First of all, we agree with you about the change that's needed in the leadership with the person that is the Postmaster General now. And it doesn't just have to do with the slowness of the mail. So many seniors get their medicine through the mail. And if that's delayed, that could be catastrophic. And we've been hearing from our members some of the same stories you referred to in mail that's been sent involving medicine. So that's another reason to have a change at the leadership, I think, and be able to have seniors get their medicine on time. It's really important to them and to their existence.
Thank you. There's one question that hadn't come up that I'm just gonna toss in. I didn't mention that FEMA has been funded to provide assistance for those who have passed of COVID and incurred funeral expenses, which would include just about everybody. The FEMA has not set up the website yet, but in about a week or two, should be up and running, and the applications will be open, we expect, online within a week or two at FEMA, F-E-M-A, Federal Emergency Management Administration, FEMA.gov, G-O-V, or you can call 844-684-6333, 844-684-6333, to get more information about that. But that will be a huge benefit to a lot of people, because obviously everyone who suffered a death will have those funeral expenses, and they should be some of the, not all of it, of course, but a substantial amount should be reimbursed. And that will be available at FEMA within about a week or two. Austin?
Yes. Bill Massey has asked a question. He's the president of the Peninsula Agency on Aging. When do you anticipate the American Rescue Plans or Older American Act funds will flow to states?
Was that to me?
It could be to Bill. I mean, he knows more about this than anybody. He's been directing the Peninsula for a real long time and has done a great job there. We appreciate his hard work. I'm not sure what the actual schedule is. My job was to vote it, to get it on the way. You know when the checks are going to go out to the areas on aging, Max?
Actually, it looks like Mr. Massey's raised his hand. Let me see if I can unmute him real quick.
Okay. There he is.
Yes.
Bill, you want to unmute?
There we
There
go.
you go.
Yep,
Yes,
we
hi.
can hear you, Mr. Massey.
Yes, Congressman Scott, thanks so much for the kind comments there a moment ago. But of course, we were interested in anticipating when these additional resources may come available to the area agencies, so we can continue to ramp up the programs and services that we're providing. And the COVID stimulus money has been a godsend to us at the Peninsula Agency on Aging. We've dramatically increased our home delivered meals or Meals on Wheels program, and we're continuing to provide transportation for medical appointments, and we are very actively involved in helping seniors get to the vaccination sites, and are working to make shots available in the homes for those who are unable to leave their homes. But thank you so much for the opportunity to comment.
Good. We'll get you that information tomorrow. We'll get some idea of when they expect the checks to go out. It takes them a couple of, little bit to, do the formula. We appropriate a top line, 1.4 billion, and then they have to divide it up amongst all the agencies to see who gets what. Then they got to write the checks. So it's a little process to it, but we'll get that information to you tomorrow.
Thank you, sir. I've done some math locally. We'll see how that plays out. Thanks
All right.
again.
Sounds good.
Next, we have a question. It says, my church has hosted several vaccine clinics. I heard that we may qualify to be reimbursed for some of the costs. Can you let me know if this is a possibility?
Yes, G, there's a webinar for churches. I think it may be tomorrow. G, do you have information on that?
Yes, it's 2 webinars will be held, one on the 9th and one on the 13th. And if your church has put on that type of event, you are eligible to be reimbursed. But we advise that you watch the webinar so that you can see how the formula and how the form needs to be filled out. And you can call the office at 380-1000, ask for me, Giselle Russell, and I'll provide you with the information for the webinar.
And it's important that we're not sure exactly what can be reimbursed, but there's no harm in asking, and that webinar will be extremely helpful in letting you know exactly what can be reimbursed, how it's reimbursed, and it's probably a complicated process. So our office is willing to work with you to make sure that you get whatever you're entitled to. Most of the churches are doing it just out of their goodwill, but if the reimbursement is there, there's no harm in getting reimbursed, and you can do other goodwill missions. So we're going to try to make sure that we get everything we can. There was significant funding for FEMA to make sure that they could continue these vaccines for free. And a lot of the churches have been extremely helpful in making sure the vaccine is not only free, but also available where it needs to be. So we want to thank those churches that have been involved, and we'll do everything we can to make sure you get reimbursed so that you can continue your good work.
And just a reminder to folks, if you want to ask a question, just use the Q&A function, or you can raise your hand. Next, we have a question. Reads, I am fully vaccinated. How many people can I be safely indoors with who have not yet been vaccinated?
Dr. Markovic, do you have the latest guidelines?
Yes. So to that end, so if you're fully vaccinated and you're with an unvaccinated person, it really should be only from one household if they are unvaccinated. So by one household, they typically say that to be 4 to 5 people. So that would be the direct answer. Although what has really been the thing that they've been pushing the most, of course, is to have these, apologize for that, had a call come in. Really what there have been guidelines been mainly though is having vaccinated people obviously be with vaccinated people, because then you can have more free range to do that. But to answer your question directly, one household or 5 people is really what it should be.
Next, we have a question. Does the American Rescue Plan provide resources for seniors who need help with home modifications and repairs?
No, it's rental assistance and homeowner assistance paying a mortgage, but not for repairs. We expect there to be significant funding for construction in the upcoming infrastructure bill, but I'm not sure how much of that will be for individual homeowner construction. The Older Americans Act can often, if Bill Massey is still around, can often be of assistance. So let me see if I can get Bill to come back on. Austin, can you get Bill Massey back on for us? There you go.
Yes, he's permitted now.
Bill, is that something that the Older Americans Act can help on?
Not directly, but we work with a lot of resource providers that can help with those situations. So contacting the area agency on aging for help is a good place to start.
Okay.
Okay.
Thank you.
Next, when will we be able to stop wearing masks?
Doctor?
The short answer on that is when we reach herd immunity, pretty much. So ideally, if the calculations work out correctly, we're hoping in the fall, by hopefully it would be a great Christmas present, ideally, but it's really once we reach herd immunity and it's safe enough that if you were to have positives, it doesn't spread, it can remain in clusters, then you can stop wearing masks altogether.
One of the things that Dr. Fauci keeps talking about is even if you've been vaccinated, wearing a mask is important because it may not be as good protection against some of the variants. Can you comment on that?
Absolutely. So on the variants, there's actually a couple of variants that we are currently tracking. So there is a UK variant, a South African variant, and actually a Brazilian variant now that's going on. The short of it is the vaccines that have currently had enough data to be tested. So that would be the Pfizer vaccine and the Moderna vaccine. Real world data has actually shown so far they've been about 90 to 92% effective against all of those variants in real time as of today. So that's a very, very good number, considering that what we were actually expecting and we would be happy with was about 70 to 75%, and we're getting 90%. So that's definitely looking very positive for us. But the reason why we always want people to wear masks is because you could still be in that 10% of group that didn't necessarily have the vaccine work for you. There's a lot of reasons why that could happen. Let's say if you have a weakened immune system, your body will not accept the vaccine as readily as someone who has a more robust immune system, or your just genetics would not absorb the vaccine. So if you happen to be in that 10% and your body has not been protected with the vaccine, that's why we have a blanket statement to have everybody still be masks, because God forbid if you're in that 10%, you would still be sick. Furthermore, there is a possibility, although rather small, that you could be a silent carrier of the disease where it won't affect you. You would be completely asymptomatic and all that. Now, granted, the chances of that are extraordinarily low, but it's still a possibility there. So I think the concern is until we have essentially a practical 99 to a 100% certainty that people will be okay, I think err on the side of caution at this point would be the smart move, because if we go through more surges or things of that nature, unfortunately, our infrastructure would not be able to handle that many patients being sick all at the same time, because we still have to take care of patients that are sick for non-COVID related reasons, because none of that has gone away. And in fact, in my opinion and what I've been seeing is that's only gotten worse because our lifestyles has changed. We've been more indoors, which means we don't eat as well. We don't work out nearly as much. We don't see the outdoors. So there's a lot of morbidities that occur with all of those types of things. So it's more because of risk. While someone might say technically they'll be safe, and that might be true, now is not the time to say we should be good as much as we need to get to the point where we are good 100%.
Thank you. Austin?
Yes. We have some questions on the economic impact payments. So they have not received their third economic impact payment. When should they expect it?
They should have expected it. They should have received it by now. And if they would go on to irs.gov, there's a spot where it says, "Where's my payment?" and you ought to be able to track it. They may have to, if they haven't filed their taxes, even if they don't owe taxes, IRS may not have their information. But if they have any questions, give us a call, 757-380-1000. and we'll help you try to track it down. But by now, people should have gotten their impact statements. The IRS had a glitch, and that we think that's been solved, and they have claimed that those checks went out from Social Security. So most of the people should be getting their checks, and if not, go online. Now, there is a category of people who haven't filed that may have gotten their check, but not their dependent's check. And that's if you don't have your dependent's information, they may not know that unless you actually file. So that you should do that. Max, did you want to comment on this too?
Yeah, yes.
You good?
Yes. Okay, thank you. There, as you know, Social Security beneficiaries, for the most part, were supposed to automatically receive their payments. But as you pointed out, there was a delay in Social Security getting the information, sharing the beneficiary information with the IRS. And that caused problems in terms of people on Social Security that did not file taxes and getting their checks. A couple of weeks ago, I think it was March 24th, Ways and Means chairman and some of the subcommittee chairmen of Ways and Means sent a letter to the Commissioner of Social Security, Andrew Saul, basically saying, get off the dime and do your job. And within a day, he complied, and all of the information was transmitted by the 25th of March to IRS. So that was the holdup for a short period of time for those beneficiaries, and I believe that's been resolved now.
The information we have is the check should have, when it started going out last week, and should have completed landing by today. So hopefully that's done. And if anyone has a check that's not hadn't landed, let us know. I know a lot of people have gotten those checks. I passed Costco the other day, and the parking lot was more packed then, after those checks came out, than it was on Christmas Eve. So, I mean, on Christmas Eve, the parking lot was full, but you could see a few parking spaces here and there. The other day, you couldn't see a parking space anywhere in the whole parking lot. So apparently, a lot of people did get those checks, and they're spending them. That's what they're supposed to do. That's why they didn't. That's why they had a cutoff on the upper income, because upper income people wouldn't spend them. You want to give those checks to people that need them and will spend them, and that will help them and help the economy.
We have a question on exposure to the virus. If someone is vaccinated and they have a potential exposure, do they still need to quarantine?
So no, they do not. Actually, the latest guidelines with that is you're actually needing to monitor for symptoms. So if you are fully vaccinated, you would just monitor yourself for symptoms. If you develop any of those symptoms, then you would definitely want to get tested. So loss of smell, fever, chills, cough, any upper respiratory and or musculoskeletal pain, fatigue, anything along those lines, then you would want to get tested. But unless you've had a continuous, regular exposure, then you would get tested right on that day. But no, you would not have to fully quarantine as you would have if you were unvaccinated. So that's one of the big benefits of vaccination.
Doctor, how available are the tests?
Very, very much so available nowadays compared to at the beginning of the pandemic. I mean, we do a lot of our own testing here at HRCHC, but a lot of the local entities as well with CVS and Rite Aid and all of those types of things. There are even some home kits that are available and a lot of those types of things. Although I think what we've seen, there's been more of a vaccine push. So some of the testing has seen a little bit of a dip when you compare it, let's say to December or January or things of that nature, but it's still readily available if you want to get tested, absolutely.
So where would someone, if someone wanted to be tested where would they
Immediately?
go? Yeah.
Really, you would want to either go a couple of places. If it's, let's say, after hours and your primary care physician's office is not open, then you would want to go to an urgent care center. Pretty much all of them are going to be equipped with testing at this point. I don't know of any that aren't equipped with testing. If any of those are closed and it's something that's urgent, so let's say it's between the hours of 10 p.m. and 6 a.m., usually that's when urgent cares might be closed, but you're having respiratory distress, you're short of breath, you have a high fever, then you would definitely want to go to the emergency room, not only to get tested, but to make sure that you're stabilized. But if it's something that you're feeling okay, you've had the exposure, but you're relatively asymptomatic, then contacting your local doctor's office, contacting any of the federally qualified health centers like ourselves, Hampton Road Community Health Centers, or any of our sister FQHCs throughout the whole entire state. We're all equipped in testing. Also, your own primary care doctors should have some testing facilities there that are available, and then your local health departments. That would pretty much be your best bets.
How long does it take to get results?
Nowadays, we've been getting them within 24 to 48 hours on the send out test. So that would be the confirmation PCR tests. But there are rapid testers available now where they can get results within, you're talking about positives within 12 minutes and negatives within 15. So the testing is definitely ramped up a lot better. And most of those rapid tests are available at your urgent cares, at your ERs. We actually have them as well, but those are going to give you a slightly higher chance of a false positive. But that send out PCR test, then that would be a confirmatory, and that will give you essentially 100% answer after that.
Okay, thank you. Austin?
Yes, looks like we only have time for one more question. The question is, will there be vaccine passports? If so, how would they work?
There are some question about whether or not on international travel, I think they're requiring evidence of vaccination. Otherwise, you're going to have to quarantine when you arrive somewhere. But there's serious questions right now about exactly how they would work and what they could be used for, and whether or not an employer can require employees to be vaccinated. Those are kind of ongoing. Those are more ongoing questions and ongoing policy. I don't know if Max, you wanted to comment, or Dr. Markovic?
Well, only that what I've been reading in the media, there's some controversy surrounding these vaccine passports. And I think what I've read is that if they may be more likely that it would be accomplished by private industry than by the federal government. I think that would address some of the concerns that people have about government intruding too much, but that's really all that I know at this point.
I can definitely touch on some of that, especially what we're currently doing. So because the vaccines are only authorized under emergency use, we're going to be very hard pressed to mandate a vaccine at that point, because someone can bring up a very, very valid concern of, well, if we don't know the long-term side effects and I were to develop said long-term side effects, what does that look on a risk management standpoint? So you're going to get a lot of places that are going to, because of that, make it much more of a optional thing as opposed to a mandatory thing. However, I say that because that's how flu shots were. And now because they've become fully FDA approved and fully validated with all of the data, those flu shots can now be made mandatory for all healthcare workers, which is what we currently do. So that's probably what's also going to occur with the coronavirus vaccines, is once we have enough empiric data to, without a shadow of a doubt, prove that not only is it effective, but it's extraordinarily safe, and it gains full FDA approval, well, then that's truly going to open the door to make a lot of those things more mandated. But then you have a solid 2 years worth of data to then back that up to see those types of things. So it's probably we're going to get more of that sooner than we think, because these vaccines have actually been in development longer than people realize. Actually, like November, December of 2019, they already had things up and running because we were able to sequence the genome of COVID-19 early on. And more importantly, this is not our first go around with coronavirus. So this is SARS-CoV-2. We had a SARS-CoV-1 and also MERS. This was about 15 years ago. So a lot of the scientists and the researchers for vaccines knew where to start looking for that infective piece. So that kind of gave them a head start with those things. But the short answer would be more so once we are able to get that 100% FDA approval, that'll open up the door for all of that to then be probably more mandatory. But I couldn't agree more in terms of private industry is probably going to lead the way more so than the government, to your point, just because of a lot of the hoops they're going to have to jump through with not only the political sides of things and the bureaucracy, but then in terms of just risk management alone. That's just going to be its own issue. But from a public health standpoint, something likely should be done. We can call it passports or whatever they may be, or testing, but we need to basically prioritize public health as opposed to leisure. There's certain travel that's necessary and there's certain travel that is not necessary. But to not then get into that, that's why I think people would just feel more comfortable having those vaccinations or at least have testing, because we would not be able to withstand another surge like we did, just recently.
Well, I think the first question would be, if you had such a plan, what would they be used for? I think that's where you would get into the confusion. Everybody has a card indicating that they've been vaccinated, but you're not denied any rights by virtue of or granted any rights, whether you have a card or not. I think the passport idea suggests that there are things you would be able to do or not do by virtue of the fact that you've been vaccinated, and that's where the discussion would start. And I think, as you've indicated, it's an emergency designation right now, which pretty well eliminates any mandatory consideration of a mandatory vaccine. And once it becomes fully approved, we would begin the discussion there. And I think the discussion right now is that you're not going to be able to mandate. You're asking for a lot, so I don't think there's going to be any kind of passport where you're not going to be able to move around unless you have this card anytime soon.
So, Congressman, this is
Max.
Max. I know you're about to wrap up, but I just wanted to say that I have participated in many hundreds of town hall meetings, real in person and teletown hall meetings and virtual town hall meetings. I don't think I've ever learned as much myself at a town hall meeting as I have at this one. So thank you so much for including me just for that reason.
Well, thank you. And I think, as Austin indicated, we're just about out of time. But Max, did you have any closing comments?
No,
Okay.
I just gave you my closing comment.
Okay, good. Okay.
I do appreciate you including me, and the National Committee has been around since 1983, committed to preserving President Roosevelt's, I think, greatest legacy, Social Security. So we continue to do that day in and day out.
Thank you. And Dr. Markovic?
Yes, I can definitely echo that. I mean, thank you for having me for sure. And also, I wanted to make a point to the one individual that spoke about his or her church doing a lot of those vaccinations. Thank you for doing that. And thank you for being involved in all of those things. I think, if anything, what a lot of this pandemic should really teach people, if they don't already know it, is we're all human beings and we need to help each other be as well as we can be safe, be well, and be happy. So I hope we can continue that in the future for sure. So thank you again for having me, and God bless you, and to all of you as well.
Oh, thank you. And I want to thank everyone for participating. There's a lot of information, and the rescue plan had a lot of very good provisions in it. You can go on and on about what's in it, particularly the part about we believe we'll be able to cut child poverty in half, the massive investment in education and a lot of other things that are in the plan. We know it's working. I mentioned people are spending the checks. A couple of days after the rescue plan was signed by the president, at least one or two of the airlines announced that their planned layoffs were canceled because of the passage of the American Rescue Plan, and that was tens of thousands of workers just in the airline industry. The restaurants are getting significant support. So there are a lot of things in there that I think will go a long way in helping us get through the pandemic. People have asked how we're going to pay for it, and I would remind them that the economists have told us if we don't do something huge, the damage that the pandemic will cause the economy will put us so far in the ditch that we may not be able to get out of it. And the chairman of the Fed, Jerome Powell, appointed by President Trump, said the risk of doing too little is greater than the risk of doing too much. So if you have to err on the side, one side or the other, the risk, you should do too much and not too little, because if you do too little, the economy will be wrecked. So we have a lot of work, and I want to thank everyone for participating. And with that, that ends the webinar for this evening. And thank you for participating.
Thank you.
Thank you, Doctor. Thank you, Max.
Thank you. Have a good evening, everybody.
Good evening.